Come in.
Hi, my name is Taye. I'll be your nurse for today. Could you give me your name and your date of birth, please?
My name is Issesha, but I go by Isaiah, and my birthday is June 16th, 1991.
Thank you, Isaiah. So you're getting ready to be discharged.
Okay.
And I just wanted to go over a few things with you. You've been newly diagnosed with asthma. Are there any questions that you need me to answer?
Yeah, I'm glad you said that because I do have a few questions.
Okay, I'll be glad to answer those questions for you. But first, I just wanted to do a little assessment of your lungs and see how we're looking and get some vitals on you, okay?
Okay.
All right. Let me wash my hands.
Okay. Better use some soap.
I'm using all the soap. All right. Let me get a listen to your lungs.
Uh-oh.
I know, girl.
Usually the mom's plays better now.
Can you breathe in for me? Again. 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 Okay. All right. All right, thank you, Isaiah. So your lungs are sounding a lot better than when you first came in, so that's a good thing. Your pulse is 86, and your oxygen level is 99%, which is exactly where we want it to be. Your temperature is 99.2 degrees, but overall, that's a lot better than where you were. So we are going to get ready to discharge you. And again, do you have any questions?
Yeah, so I want to be able to play soccer. Am I able to still play soccer?
So yes, you are still able to play soccer with your asthma. There are a lot of professional players who do have asthma. As long as you keep your albuterol with you, which is this medication right here.
Okay.
And albuterol is what we call a rescue inhaler. Okay. And what that means is if you feel a sudden onset of your symptoms, you're going to take this medication and it will relieve your symptoms of asthma quickly.
Okay.
Okay. Any other questions?
No, not at this time. But I was warned that this might be the end of my soccer career. So now I know that I'm on an antibiotic, and I hear these can mess with the birth control pills. Do I need to be worried about that?
So with the particular antibiotic that you're on, no, you don't have to worry about that. Ciprofloxacin does not interact with your birth control.
Okay. Okay, good. Well, that's good to know because I don't have time for any baby child.
I understand.
Okay.
I get it.
So my next question, this is the weird thing. What do I do with it?
Oh, you mean this flow peak meter?
Yeah.
Okay. So what the flow peak meter does is it measures how well your lungs are able to expel air. Okay. And with regular use of this, it helps you monitor your asthma. Okay. Because what's going to happen is your doctor is going to give you a particular range or a zone that you're supposed to be in. Okay. And whatever your best range is, that is what your particular reading will be for flow test. For example, if your highest range, your doctor does your test and your highest range is, let's just say 70. Okay. You would take this and you would blow into it. Okay. And it would give you back information. It would either tell you that you're in a green zone, which means you're stable. Your asthma is stable, you're breathing well, everything is working okay. Okay. Now, if you get it and it's in a yellow zone, that means your asthma is flaring up a little bit and, you should take precautions. make sure you should always have your rescue inhaler with you anyways, but make sure you have it. And make sure you've been taking all your other medications that go along with your asthma medications.
Okay.
Now, if you're in the red zone, that means that you are at risk to have some type of asthma attack, and you should seek medical help. Either come to the emergency room if you're really, really bad off, or try and schedule an appointment with your doctor.
Okay, I can do that. So can I try it?
Yeah, sure. You can definitely try. So the first thing you're going to do is you're going to take the peak flow meter, and you're going to take this part, and you're going to move the marker down to the bottom.
Okay.
Okay. And which will the bottom of the number scale.
Okay.
Then you're going to connect your mouthpiece. Okay. Okay.
Okay.
Once you connect your mouthpiece, and I'm just going to show you how to do it first, then you can do it. Once you can connect your mouthpiece, you're going to stand up.
Okay.
Take a deep breath, fill your lungs. You're going to put your mouth on your lips around the mouthpiece, and you're going to blow quickly. Okay.
Okay.
And you're going to do that 3 times.
Okay.
And of the 3 times, you're going to record the number that is the highest.
Okay.
So are you ready to try?
I'm ready.
Okay, I'm going to take it apart.
Okay.
And I want to see you put it together and do the whole thing.
Okay.
There you go.
I have to stand up.
Good. One more time. Good. One more time. Good. Now, each time you do blow, you are supposed to write your number down. So that was my mistake for not telling you.
Okay.
So let's try it one more time. And this time we'll write your numbers down so we can get used to doing it.
Okay.
So do it again, please. All right, let's look at that number. So we got 69. Let's do it again. Okay, we got 69 again. One more time. Good, we have 70. So you would take the highest number, remember, and remember your range that your doctor has for you is 70. Okay? So good job with that. Was it hard?
Not at all. I do have one more question.
Yes.
How do I use the inhaler?
Good question. So your inhaler, it's just kind of the same way that you do your peak flow meter, okay?
Okay.
So since it's the first time you're using it, you want to prime your inhaler. And what that means is you want to shake it
Okay.
for about 10 seconds.
Okay.
You want to remove the mouthpiece.
Okay.
And you want to check for anything that might be in the mouthpiece. You don't want to suck in anything because that, can make you cough or choke.
Correct.
Once you know the mouthpiece is clear, you want to spray it 2 times. Okay?
Okay.
Once you sprayed it 2 times, you're going to push all of your air out.
Yep.
Once you push all your air out, you're going to put your lips around the mouthpiece.
Okay.
You're going to push this button and breathe in deeply and hold your breath for 10 seconds.
Okay.
Okay? And you're going to repeat that as many times as your doctor has told you to. Okay. And in your case, your doctor has told you to do it 2 times.
Okay.
Would you like to try?
Yes.
Okay.
Do I need to stand up?
You don't have to stand up to take your inhaler, and you don't have to prime it because I've already done that step for you.
Okay.
So you just need to
remove the cap.
Remove the cap.
Check inside.
Check inside. You don't have to spray it.
Okay.
Blow out all of your air. Put the mouthpiece up. Push the button. Breathe in. Hold your breath for 10 seconds. Good. So now, do you have any more questions?
Yes. Can I leave yet?
Yes, Isaiah, you can leave. But before you go, I do also have a pamphlet for you.
Okay.
Just about asthma.
Okay.
Okay. And it just discusses some of the information that we talked about today. Okay. It talks about what asthma is, what symptoms you should look out for, things that can trigger your asthma, such as exercising, like I was speaking with you about earlier. When you go to play soccer,
Okay.
any of your games, you always want to have that rescue inhaler with you.
Okay.
And there are your other medications that you were taking that are your long-term medications. They just help control your asthma over all the time, okay? And then you're also taking a medication that helps with your allergies.
Okay.
So it kind of helps because allergies is something else that can trigger your asthma. As a matter of fact, give me 1 minute and I'll go get your medication list from the doctor.
Okay. Thank you.